Good day. This is part 2 of my talk, recognizing risk in young people when they feel disappointed. And I want to address this first part completely to young people. There is a height in you God your Father has given you. It's a good gift. It has to be perfected, increased. If you are not getting into that good and perfect increase, you begin to feel disappointed. So if your passion and energy can go into not many things. So what happens is that your steady increase step by step gets obstructed by short-term pursuits, interests, thrills, every day, changing hour to hour, which is what digital games do. And the behavior pattern of risk-taking that digital game induces. Then you are not thinking of long-term relationships, short-term, quick gain kind of relationships. They can't sustain you for a long time. And the fantastic projects you have in mind all need a lot of energy, a lot of innovation. You can't sustain them for a long time. But when you are working with the gift that is in you, with studies and vocational training, hobbies and relational interaction meaningfully, those from whom you receive and you give back, your own age group as well as seniors, that's the way of how the human soul becomes built little by little, little by little. So in this context, we want to know, you need to know that the digital screen induces an electronic cocaine-like situation. That's what Cerner Learn articles refer to the screen, because you are meant to, we are designed to do empathy, top-down regulation, initiation, navigation, successful in conclusion, good reward. And you yourself say good reward. So dopamine helps you to keep focused and do it. And then serotonin does a check back of how do I improve? How did it go? So it's a good inquiry. So this check back and wanting to improve is how God has designed us in our default mode network of thought. That's what our check back is doing. How can I improve? But when dopamine, we are too much on the screen and dopamine becomes addictive, shifting from physiological DA1 receptor to addictive DA2 receptor, you're not thinking of check back and see. You want to do more, next thing, same kind. Then it's after a long time you feel dopamine depleted. I'm getting nowhere. I have lost energy. No, because you have expended the energy you had for reward for something else. Then you lose the reward motive and you begin to operate on the default motive. That you begin to enjoy pain and disappointment, harsh talk, and expect failure, and they think I am a failure. So that mode can't go on for long. You feel like ending your life. So if any friend hears, I don't feel like living, from another friend, take it seriously. And the risk factors of isolating, not coming for meal times, avoiding company, increasingly more on the screen, and disturbed sleep times and up through the night with digital activity, these are preludes to more dangerous risk-taking behavior. You need to identify them. So secondly, digital games attempts perfection, win every time, can't fail. So digital games gives kids an idea you can't fail. No, life is not like that. You try and sometimes you fail. In any sport, you may miss. So digital games gives you a sense of I can't miss, I can't lose. So take care. Thirdly, parents feed, perform or perish, run their races through children activities to win their trophies. So there's a discrepancy between how parents expect from you and how you think is the best of life. Discrepancy is increasing more and more. Now it came in the millennial generation, it was there in the Gen Z generation, much more in the Alpha generation. So we need to take care as adults what they tell them, and young people need to take care that you convey your desires and have a meaningful chat rather than a war at home. And parents don't create war, don't fight your kids, listen to them. By listening to them, enter into their confidence. If you want to say one thing, you have to listen to them for 50 things. Then they begin to trust you because you're walking by their side. Digital games shift kids from top-down empathic executive thinking to set up the thrill-seeking repetitive bottom-up track working through the amygdala and hypothalamus. Then they are all the time feeling dyspathy, repetitive, reactive, reflexive, short patience behavior. So they shift from dopamine 1 physiological to dopamine 2 addictive. Sixth one, thrill seeking will get to the point of risk, do and damn kind of thing. And your level of risk assessment gets blunted. So you initially take a selfie from a balcony leaning over and you can recover the balance. But increasingly you try to take selfies without assessing the risk of the fall. Then you fall. And the kind of risk you take sexually, gambling, money, in different ways increases because your risk assessment now is damaged because the digital screen gives you a increasingly risk-taking potential. So at a certain point, fastest digital game is boring. Then you think, I'll do some real life risk. Seventh one, dopamine depletion leads to self-harm to induce endorphin action for feel cool. So when dopamine is less, getting less and less, you can't get the same thrill. Then you cut yourself or do something like that to feel cool, because when you induce pain, internal pain relief mechanisms with endorphins come. Then after a while, that is not enough. You begin to take other pain relieving, substance abusing opioid molecules. Then there are apps and games that promote suicide. The ninthly, extreme selfie behavior promoted by digital screen makes children isolated and selfish, with no thought of anybody else's loss. So our relational nature, empathic relational nature, is eroded because we have worked with machines and screens so much. Let this not happen to you. Always have meaningful relationships. 10th one, competition builds up to be the most liked on social media and the best super. So TikTok and everything, you are trying to present a picture that is not real. And it's stressful. You can't be the top of the charts all the time. And the innovations have to be all by you. Because this is not a team play sport. So you need to take care that someday you will feel depleted. But on the other hand, if you are on a study course and training, doing it with others, then there's a step up in which others are also shouldering and carrying on. Then people on the Snapchat can change their face with all kinds of adaptations, and you can come to a stage not knowing exactly what you like about yourself. In fact, any shape and any redone face you may begin to hate. So take care. God has given you the best face. Work with it. Then digital abuse promotes addictive substances, and you can feel gain or bust. 13, digital abuse promotes addictive substances, which promotes destructive behavior, risk-taking behavior, gambling or sexual, different kinds of rape. So overuse of methylphenidate also causes a certain aggressive behavior. It has its place in attention deficit disorder, every other day dose. But daily dose of different agonist drugs will increase your insomnia and aggressive behavior. Sexual experimentation can become common, and you lose that part of the sanctity, sacredness of life. It really demeans after, because you will be, after that you will be treated like a piece of flesh, and you will also lose value. Fourthly, no doubt, Other sexual disorientations, transgender confusions, bring on personality disorders, and at present in Sri Lanka, 30% of psychiatric consultations are for kids under the age of 19, which is sad. So, smartphone obsession is having the twin rise of the smartphone and social media has caused a real earth tremor. Compelling evidence that the devices we placed in young people's hands are having profound effects on their lives. Professor Jean M. Twenge, Professor of Psychology, San Diego University, has stated it clearly. I have also written on this extensively. So, little more details. Not infrequently, the bizarre, the paranormal, gets into monsters and in the programs you are doing. So you think it's a scientific tech thing, it goes beyond that. There are evil and unnatural, supernatural, evil forces that are being invited in many games and in different tactics. You can't sleep then, you're not thinking for yourself, you begin to hear voices inside you asking you to do destructive things. Please, before that, you need help, and please get to that help. So, when you move away from knowing the Good Shepherd and what was traditional, conventional, you begin to look for phenomenal spirituality, that's out-of-the-box kind of thing, out-of-body experiences that encourages or that provokes anxiety, depression, and destructive behavior. So we must remember this, that chronic fatigue syndrome is commoner in girls because they lose dopamine faster, and with the lack of testosterone, they begin to feel lethargic and useless. Boys, on the other hand, tend to experiment with thrill and peril much longer, and then get utterly dopamine addicted into dopaminergic behavior. Self-existence, competitive, all that goes on. And if kids get into exchanging lurid photographs and come under threat, it becomes an additional risk factor. They lose worth and they lose value. So be careful of avoid such behavior completely. Then, of course, increasingly study becomes difficult because your attention span has gone down, and then exams bring another kind of dread, which is an unnatural dread. Whereas if we study step by step and in parallel get into the vocation that we would like to, God has designed in us, then we have a step up growth. So I have spoken at length this second talk on the factors that led to the precipitation or risk behavior. My first clip I dealt directly with immediately recognizing risk of suicide in kids. I spoke to kids and parents together. So you can ask for clip number 1 or clip number 2. What you should call it is risk prevention. Thank you for listening. I'm Dr. Lalith Mendis. If you want similar clips or any other subjects on spirituality, reason and science, please drop me a WhatsApp to +94 74 211 5011. You can also download these clips from my app Golden Nuggets. I'm Dr. Lalith Mendis. You can download the app free of cost from Google or App Store. Thank you for listening.